All right, hi guys, it's Dr. Denny over at Four Paws at Fulshire Veterinary Clinic, and we're going to be talking about some frequently asked questions that you may have if your dog is going to have surgery. So Ashley's going to go ahead and help us out here.
Dr. Denny, what can I expect for my dog's upcoming surgery?
So you should be able to expect that you'll get a phone call the day before explaining, not to feed your dog after 9 o'clock. Water is fine. And then not to feed breakfast the morning of. And then our drop off for surgery time is 8 a.m. You should expect that you will get communications throughout the day, letting you know the progress of the surgery, when your pet is in recovery, and when is a good pickup time. You will also have a discharge that goes home explaining post-op pain medications, what to look for, and things that might not be normal, and how to help care for your pet after anesthesia.
What questions should I ask my veterinarian about my dog's surgery?
So I think at this point you would want to ask me if something's making you nervous, okay? If you are scared about the procedure, if you are nervous about anesthesia, those are questions that, we need to go ahead and have answered and have put to rest before you're dropping off for surgery. I want to make sure that you have full confidence, and we might have some nerves, but I want to make sure that all the questions that you might have about recovery time, when your pet might be ready to go home, what maybe do we need an e-collar or a surgery suit. So all these types of things are questions that I would want you to ask me prior to dropping off for surgery.
Will my dog go under anesthesia during surgery, and who will monitor them?
So yes, if we're doing like major surgery, so if we're repairing an incision, removing a growth, doing a dental, doing abdominal surgery of any type, or placing a cast or a splint, then yes, your dog will be under anesthesia, usually full general. So they're not going to feel anything, which is the whole reason we do it, right? We don't want them to feel what's happening.
Will my dog be intubated for surgery?
So that's a really great question. So for major procedures where we need to protect the airway, intubation is where we place a breathing tube called an endotracheal tube down the trachea, and we inflate a cuff to make sure that there's no risk of aspiration. So it protects their airway. So in most procedures, yes, if we're using full general anesthesia, then yes, your pet and your dog will be intubated.
How will my veterinarian communicate with me during my dog's surgery?
So I utilize my technicians heavily. So we do a lot of text messaging. We send pictures. We do phone calls. If there is a problem in the middle of the procedure, I will get you on the phone on speakerphone while I'm scrubbed in, and I will talk to you. Especially if something life-threatening has happened, or if we're needing to abort in a procedure because something is not, maybe the pet isn't doing well under anesthesia and I've decided that the risk is too high. So in that event, you will hear from me directly. But most of the time, it's going to be the technicians that are communicating with you.
Will my dog be in pain during and after surgery?
So during surgery, they're under anesthesia, okay? So they're not feeling anything. That's the whole reason we have anesthesia, right? So you don't feel anything. I've had surgery a number of times, and yes, I didn't feel anything because I was asleep. That's the whole point. Now, post-op, when they wake up, is there going to be some discomfort? Of course there is. We have cut into the body. We do put a lot of thought and a lot of effort into multimodal pain control, meaning we do local nerve blocks, we do incisional blocks, kind of like if you go to the dentist and they do dental nerve blocks so you can't feel what they're doing in your mouth. We do we do blocks like those. We do 24-hour long anti-inflammatory injections, including oral meds to go home. We do injectable pain meds with oral pain meds to go home. So will your pet experience discomfort? Of course, but do we do the best we can to alleviate that discomfort? Yes.
Last question. How effective is surgery in dogs?
So it depends on what we're doing, right? So if I'm removing a massive tumor where I'm having trouble getting margins, we might not get margins. And if it is cancer, maybe we are doing the best we can to take the biggest portion off for comfort and quality of life of the pet, but we may not get it all. So it could come back. I would say in those instances, which doesn't happen often, surgery is going to buy us time. Okay, but it may not be 100% of a cure. For something like a toe amputation, that's going to be a cure, or a tail amputation, that's going to be a cure. Going in for abdominal surgery to pull out bladder stones, we are getting rid of the bladder stones. Therefore, it's done. You're fixing the problem. Now you probably have to do diet change and other things to make sure the stones don't come back. But also, like if something gets stuck in the intestines and we go and remove it, we are fixing the problem. So the majority of the time, surgery will fix the problem, but there are risks and complications, just like there are in human medicine. And nobody's perfect, and nothing's 100%. So I hope this helped answer some questions. If you do have further questions, please feel free to give us a call and set up a consult, and we would be happy to go over this with you.